mother and 5 kids living in a 2-bed motel room for 3 years. This is the reality for one family in crisis housing in regional Queensland.
Homelessness in Australia is at an all-time high, with more than 92,000 families across Australia receiving help from homelessness service in the past year. However, families in regional Queensland access services at a rate almost 4 times higher than major cities. With no permanent housing available due to the housing crisis, this has led to families having to live in motels, often for long periods of time, unsuitable for family living.
Social science students at the University of Queensland, on behalf of the Queensland Council of Social Service, carried out research into the growing number of families living in motels across regional Queensland. From the views of the frontline service providers, it is clear that these families are facing a crisis.
After consultation with QCOSS, we spoke with frontline service providers to understand the impact that it is having on family wellbeing and the challenges workers face in supporting them. We asked workers about the new responses they've adopted to do this and what they think is important to help families transition out of motels.
As a starting point, we looked at previous studies' findings and discovered that a mix of social and systemic pressures are pushing families into motel crisis housing and keeping them there. We used 2 theories to guide our research and analyse results. The first is Maslow's hierarchy of needs, which shows that people need more than just food and shelter to thrive. Families also need safety, stability, and a sense of belonging. The second is Maslow's theory of burnout, which explains how constant stress, heavy workloads, and moral distress can lead to exhaustion for frontline workers, affecting their well-being and ability to support families.
We conducted 2 focus groups with 10 workers. We transcribed these focus groups and applied thematic analysis, which looks for common themes and opinions in participant responses and collected them back together to report back to QCOSS. From this analysis, several key themes emerged, including family wellbeing impacts, challenges to regional service delivery, frontline worker experience, new practices and approaches, and factors to consider when transitioning to permanent housing. Our research presents evidence to improve regional motel crisis housing services and advocate for better long-term housing options.
Their findings shed light on the emotional, social, and systemic pressures affecting both families and the people supporting them.
Frontline workers told us families are staying in these facilities far beyond their intended short-term purpose, which takes a toll on family wellbeing. Motel rooms often lack basic cooking and washing facilities, which frontline organisations have to provide. One worker reported that there were no minimum standards in the hotels, describing some conditions to be horrendous. There's very little privacy, and motels are not safe for children to run around and play and not free to be kids. Larger families struggle the most with overcrowding, and workers reported that it's almost impossible to find long-term housing for them, and as a result, they're falling through the cracks.
Many families are also experiencing rising stress, relationship breakdowns, and worsening mental health due to the instability of motel living.
We found a number of challenges specific to the regional context. There are long distances between motels, making it harder for workers to have time with clients and very limited motel capacity. Families also have to compete with tourists and FIFO workers that are prioritised by motel chains. One worker reported that some families have to keep moving every few days during peak seasons. More people are accessing homelessness services too, including rough sleepers pushed out of cities. Workers described crisis housing as bottlenecked. Urban sprawl and a lack of new builds increase rental prices. One worker reported that the price of a 3-bedroom house in their region almost doubled in the past year, from $350 to $600 a week.
Workers describe the government's crisis accommodation program as a hamster wheel that keeps families in a holding pattern, and social workers are struggling to provide adequate support. Workers are bogged down by reporting and frustrated with limited long-term housing options. This is taking a toll on their mental health, leading to burnout and moral distress.
Many workers reported being caught in a cycle of crisis response, managing demand rather than addressing long-term needs. The program is reactive, not proactive.
Without clear motel standards or flexible funding, staff often feel powerless. They want to focus on people, not paperwork.
Despite these challenges, workers are developing creative ways to support families.
Frontline workers told us that building good relationships with motel providers makes a huge difference when delivering their services. Some organisations have established weekly meetings with staff to ensure open communication between motels and client families, which improves room retention rates. Workers have also adapted to the challenges of distance in regional areas. They connect families with wraparound support services such as domestic violence counselling. To help workers save travel time, some families now record their motel room conditions and send that information to workers.
The most common recommendation from frontline workers was to provide place-based crisis housing solutions. They want decision makers at the Department of Housing to sit down at a roundtable with regional practitioners so that they can actually understand the problems they face and provide specific solutions.
Frontline workers also want minimum living standards established for motel housing and trauma-informed training for motel staff.
Workers also recommend a review of program funding allocation to include more cost-effective non-motel housing options.
These workers are passionate about their clients. They're taking the initiative to be creative and work with families and motel staff to find solutions. We believe that our research has led important voices to be heard on this issue, and we look forward to future research on motel crisis housing.
Well, there are so many families who are living in motels at the moment, and the number just keeps growing. So it's so important that we have research like this so that we can really understand the impact of the motels on the families, the challenges of delivering services to these families in the motels, but importantly also the exit pathways and how we can support families to leave the motels and transition into more affordable and permanent housing, particularly in those really unique contexts such as regional Queensland.
This research will inform QCOSS's future policy and advocacy initiatives to push for systemic housing and homelessness responses to end the housing crisis in Queensland and achieve safe and affordable housing for all families.
Thank you for watching this special news report. Good night.